Good afternoon, and welcome to the final panel of this meeting, the kind of finale of this artful composition. And the aim of this particular session is to summarize the very wide-ranging and rich discussion that we had over the last 2 days, and try to distill some major observations and perspectives, and perhaps also certain lines of thought that we can carry forward. And towards that end, we have asked each of our co-moderators from every panel here assembled on stage, and we have been asked them to kind of, in no more than 10 minutes per panel, to present the main points from their respective sessions. And we have also asked them to identify some of the remaining open issues for discussions today, and let them also go into opportunities for inputs or gaps in our understanding of the issues that have been presented. So when each of the co-chairs have finished and we have had this review of the panels, we will then have first of all, a moderator discussion here on the stage among the moderators, identifying some of the main topics, and then of course we will open it up to a discussion with you, with the audience. And in commenting, I would invite you to address, among any comments you make, the issues and themes, including the various gaps and opportunities for further exploration of the issues that our chairs have identified. Again, we want to bring out a wide range of opinions and ideas. So with that, I'll now turn the proceedings over to my co-chair, Dr. Feinberg, who will call on each of our co-chairs.
Thank you very much, Dr. Dijkgraaf. At last we have answered the age-old question, who will moderate the moderators? And you see it is we who will do it. We're really delighted to have the pleasure of this final session with all of you. As Robbert said, we've asked each group to take up to 10 minutes, but we've invited each to decide on its own how they wish to use that time amongst themselves, one, both, in whatever division they would like. And so we'll begin at the beginning and turn first to our panel number one, the co-moderators, Drs. Subbarao and Webster. The floor is yours.
Dr. Webster and I agreed that I would summarize what we thought was discussed in our panel, and will both be available for questions. Could we have the first slide, please? Yes. The next one. So the discussion questions, we first took the questions one by one and put down our thoughts of what a summary. So the first question was what the different types of gain-of-function experiments had been conducted to date that had resulted in new strains of HPAI H5N1 viruses with increased, transmissibility or altered host range. And so what came out of our session was that such experiments had provided valuable information on the HA cleavage site, receptor specificity, tropism, transmissibility, NS1 and innate immunity, as well as drug resistance. The second question was whether the HPAI H5N1 gain-of-function research had contributed to public health, and if so, how? Had the already published studies been applied to improve biosurveillance? If so, how, and how might they be applied in the future? So the answer to this from our panel was yes. The information has been applied in Vietnam and Indonesia to enhance an early warning system. A WHO collaborating center is being developed in Indonesia, and local politicians have become more aware of and more interested in H5N1 research and in transparency. Part B was how these findings have been important for countermeasure development, and if so, how? And the answer again was yes. These findings have led to validated diagnostics, efficacy of antiviral drugs have been evaluated, drug discovery, and there's more of a push to respond to outbreaks in poultry. There's been specific guidance. It will provide guidance to the WHO and FAO on priorities. And there has been vaccine production and training in developing countries that has come from, prompted by these discussions. Are there potential benefits to be gained from future HPAI H5N1 gain-of-function research? So here we were asked about benefits, but we actually also included some of the risks that were discussed. The benefits were a better understanding of the biology of pandemics and understanding the fundamental changes that are required for transmission of influenza viruses. And another benefit is innovation, that this will drive innovation. The risks: surveillance information is not available rapidly enough. There's a concern that we would not be able to stop the spread of a virus, as was seen with the pandemic H5N1 in 2009. There was a concern that the information is not practically useful enough to justify the risks. And a question that was raised was how can a government know how the information would be used? Are there risks associated with not conducting the research? If so, what are they? So this was described by one of our panelists as the ethics of inaction. Drug targets, like drugs that are targeting polymerase function or drugs targeting host functions, or those identified by gene expression profiling, would not be identified if such research was not conducted. And another concern that came up in other panels as well was the fact that younger scientists would be less willing to get into this field of research, and there would be a collapse of future advances. So the summary points, the overall assessment was that the majority of the panelists felt that the benefits from gain-of-function research outweighed the risks. There was a consensus that field surveillance needed to be enhanced. We would need to work with local scientists at the grassroots level and prioritize and fund labs in the field for surveillance. We need to link virologic and epidemiologic surveillance. We need efficient and rapid surveillance, and we need studies on host susceptibility in family clusters. Open international sharing of surveillance and scientific data is essential, and it's very important to understand how the identified mutations function. We need international agreements on the level of containment to work on such viruses and experiments, and this was certainly discussed in the last session. And a point that was raised was that SARS coronavirus and the 1977 H1N1 viruses are not good comparators for HPAI H5N1 research, as it is done today in the United States with the Select Agent Program and other regulations in place. Some issues for further discussion. How do we identify risks and develop interventions? If an experiment is identified as an experiment of concern from the start, but answers a legitimate scientific question, who funds it and how are the data to be communicated? How will funding agencies of other countries be made aware of and encouraged perhaps to consider the HHS framework? And lastly, has this moratorium now served its purpose and is now inhibitory? So with that, we will close our, there were two we wanted to add, particularly note some insightful comments. There was one by Ron Fouchier that the studies that we are talking about today by his lab and Yoshikawa's labs have not really shown a bright light on influenza transmission. This is just the start of studies on influenza transmission, and that Mother Nature is the greatest bioterrorist threat. So with that, I think we've closed our summary.
Thank you very, very much. Dr. Webster, is there anything you want to add to the initial presentation?
No, I think Kante has covered the summary very well. I'd just like to draw people's attention to that last insightful statement. There is a feeling that the studies of Kuoka and Fouchier have thrown a great deal of light on H5N1 gain of function and transmissibility, when in fact they haven't. They've simply made it aware that it is possible. That is all. How it occurs, we don't know.
Kante, could I ask you as a clarification on this point about the SARS not being a good comparator? Could you elaborate on what you meant by a good comparator?
So what I was relaying is a comment by Nancy Cox, and she's next to you. But so to paraphrase my interpretation of that, when we worked on SARS, certainly, and there's a lot of reference to lab accidents and releases and so on, H5N1 research in the United States is very closely regulated by the Select Agent Program, with a lot of measures in place, both physical and procedural, that were not in place in some of the labs where these laboratory accidents or escapes occurred.
So it's a caution about drawing too much of a lesson from previous accidental releases, unintended releases, compared to standards of today?
Right, and the comment that is made that since that had happened, that therefore it could happen again with H5, and that somehow a more virulent virus is even more of a risk for such an event. You know, we all acknowledge that accidents occur, but there are a number of physical and procedural protections in place today with H5N1 research that were not in place in 1977 and were not in place in parts of the world for SARS.
Very good. Thank you very much. If we've now had a good sense of the main ideas from panel number 1, perhaps we could move along to a counterbalance. In a way, panel 1, which was focused on the benefits, also introduced risks. And now panel 2, which had its subject of the assessment of risks, we will hear the perspective now from Drs. Cox and Shinomiya. And I believe, Dr. Shinomiya, you will make the presentation. So please.
Yesterday, panel 2 focused on risks and concerns associated with highly pathogenic avian influenza H5N1 gain-of-function research. Could I have the next slide, please? Yep. And next slide. So we had. So we had 3 important discussion points. The first question was, what are the specific risks and concerns associated with influenza gain-of-function research in terms of biosafety risks, biosecurity risks, and other dual-use issues, and undermining international public health or pandemic preparedness agreements. And the second question was, which components of highly pathogenic avian influenza H5N1 gain-of-function experiments raise particular concern, such as transmissibility, pathogenicity, and host range, and so on, and the combination of the above. And the last question was, are there experiments that should not be done, and if so, why not? And we made discussion based on this third question. And also we considered 1 and 2. First, I would like to summarize the discussion point from each presenter. Dr. Kapoor said the potential of having pandemic pathogens released is not a major concern in developed countries, but that is not true in other parts of the world. If we generate the gain-of-function research data and put it in the public domain, the risk of accidental release should be taken into consideration. Dr. Lee said the scientific community must prepare for a worst-case scenario. Biosafety level 4 may provide the most stringent possible protections, but this is not the case of H5N1. This is just a general conception. And Dr. Casadval said, gain-of-function is a very powerful tool to understand the virus. There is a huge risk in not doing the right work. The most important protection against pandemic is to keep the research community vibrant and healthy. Dr. Kobinger said, easy to see risk of accidental release, but not easy to explain the risk of not doing the work. In terms of biosafety risks, the question is whether containment is adequate. In terms of biosecurity, there are always risks. The question is if the risks are acceptable. And Dr. Colglazier said thoughtful oversight of US-funded research is needed. International dialogue is essential to mitigate any risk of bioterrorism. The goal of these efforts is to reduce risk without harming research that needs to move forward. Dr. Epstein said, consequential research requires greater scrutiny. Some experiments not worth potential risk. Can't assume we know motivations of all, so should not narrow, constrain biosecurity, possible use of the information or the time frame for consideration. Dr. Carr said, should carefully consider misuse, but use of biological weapons compared to other terrorist weapons is rare, and total number of people who have died from bioweapons is less than the number of people who die of seasonal flu each year. H5N1 experiment require cost or risk-benefit analysis. Dr. Sassano said surveillance and early detection plus vaccines are critical to emerging infectious disease control and eradication. Indonesia faces many problems beyond H5N1 and must manage risks posed by many diseases. Ensuring lab workers' safety is a major concern. Dr. Parker emphasizes investigating in science to achieve a goal. Goals of this research should be clearly stated. Rephrase questions to put in a different light allows us to apply reason with less emotion and to explain why experiments are important and to mitigate risks. Needs to find better ways to identify those who would misuse information from experiments. Dr. Rubin emphasized freedom of thinking and the importance of conducting gain-of-function research. Need to understand legal landscape for international agreement and find a way to harmonize approaches internationally without suppressing science. And from the panel discussion, these four points were very important points. First, dual-use research concern does not mean don't do the experiment. There are risks of not doing the research. So explanation why the research is needed is essential. And we should tailor our experiment not to be used for malign purposes. The second one is people shouldn't suppress information but learn how to deal with it appropriately. Third, regarding the concern about containment, safety issue is still important. The research has to be in the appropriate facility. We need to reframe for better communication with the public. And the question raised, how do we frame the burden of proof? And self-governance, funding frameworks, education, those things might be the kind of proof. And lastly, discussion was made from the audience and need better explanation of the benefit versus the risk of gain-of-function research. Limited funding is a reality. Funds should be allocated to the most important projects. Reframe questions to better communicate to the public, the risk-benefit discussions. Should be more data available in the public domain about laboratory-acquired infections and the public health implications. Finally, we raise question, will we need to wait for the perfect vaccine and the perfect set of experiments before we can proceed? That's all. Thank you very much.
Thank you very much. Dr. Cox, is there anything you want to add from your perspective?
No, I think he covered things very well.
Very, very good. One question I guess I would ask, in the discussion, there was a certain amount of conversation about informational risk as distinct from, if you will, virological risk. Is that something that you feel needs to be considered further, or have we amply enough articulated the nature of the risk from information alone?
I think not to provide the true information based on the scientific research is such a kind of a concern. So at least I believe that we need to, we should explain in a very easy word to the public, and we need to show our result to the public so that the public can understand the experiment very easily, and maybe and hopefully the public will support our experiments.
I was actually referring to this idea that, that the information about the experiments itself could be a risk in addition to the agents that are used or developed, and whether that is a matter of ongoing concern.
Just one question. Yeah. Mitigate the risk is, to mitigate the risk is very important point, but I think the information, basically the information should be open to the public.
Uh-huh. Okay. Nancy, do you want to comment on this or another point?
I think it is very important, once again, to emphasize that we in the influenza community have not done a very good job of really delineating the benefits. The risks are kind of obvious, and that in communicating the information in a responsible way, certainly those benefits need to be explicated in a way that people can understand it. So I think I have a lot of questions left about how we might move forward with a proper explanation of why these experiments are important, because I don't think the message has come through at all well.
Great. Thank you very, very much. Okay, we're at a point now we can move on to our next panel co-chairs. As you'll recall, panels 3 and 4 were pretty closely connected in that panel 3 focused on the framework per se, panel 4 introduced the case studies, and there was a kind of iterative relationship of lessons about cases from the framework and lessons about the framework from the cases. And so what our moderators have elected to do is to combine the presentations in an integrated way over panels 3 and 4. And as there are 3 different individuals involved, Drs. Patterson, Stanley, and Dixon, we're going to turn to them and give them collectively a total of 20 minutes to cover the reports from panels 3 and 4. So the floor is yours, and we look forward to hearing.
So I'll lead off, and thank you, Dr. Feinberg. This just reminds you of who was on panel 3, which really dealt with the proposed framework and asked for comments on it. Panel 4, as you've heard, was devoted to the case studies, and as I said, this really is going to be an integrated presentation. Panel 3 was really charged to discuss a number of questions. I think these 2 were paramount. We really wanted their perspectives on the proposed Health and Human Services framework. And then a question about whether there were risks, or basically things that weren't identified by the framework, including those that had been identified in Panel 2's discussion. Panel 4 dealt with a series of cases, as you know, and the question was, how well did the proposed framework function in the analysis of each of these case studies? Was it a useful tool in guiding funding decisions? That's obviously critical to its existence. Does that framework appropriately address the range of risks associated with the research? And did it provide for appropriate review of such research? And are there gaps that should be addressed by the framework? And you'll hear comments in a second that address, I think, each of those questions. And what we're going to do is we're going to divide into general points that were raised by individuals and then very specific points about the case, particularly raised by the case studies about scope, criteria, and department level review, and then we'll conclude with gaps. And so I'll begin with some general points about the framework. We felt, as we looked at the comments that came from the panel and from the audience as well, that there was general acceptance of the concept of a Health and Human Services framework, and that was both from our domestic audience as well as our international audience, and I think that was important. There seemed to be a general agreement from those there that some type of an additional review of gain of function, highly pathogenic avian influenza H5N1 research was indicated. And this was generally described as a significant and positive step forward, but it was recognized that there was much more work to be done to refine this framework and make it effective. And in fact, it was felt that the framework could serve as a useful guide to identify some proposals that might require oversight and further review, but in some sense it might be too inclusive to be functional. In other words, too many things might be caught in this net essentially to make it functional, and that was a concern about what was brought over. There was certainly concern about the language, and again, we appreciated comments from the audience, and there's going to be a chance, of course, to comment further as this is put up for discussion. People can email additional comments, but there were terms that people felt should be defined better, so terms that were vague terms, particularly foreseeable future, I would say, which was one that caused a lot of concern. Evidence, what did evidence actually mean? What would be required to be presented? Significance, I think that's a little less of a concern for those of us who submit NIH grants. I think we have an idea generally what significance is, but that was brought up as well. And then sufficiently mitigated. What did that mean to be sufficiently mitigated, and who would make those kinds of judgments? There was a discussion that if this is done, it should be harmonized across all of the Health and Human Services agencies, and that's important. We don't want multiple frameworks essentially across agencies. We needed to take into account as we do this the fact that this funding decision also is going to impact the international research community, that Health and Human Services doesn't just fund researchers in the US, they fund researchers abroad as well, and it's important to recognize that this could have a chilling effect if not done right on international research. And again, as been mentioned before, we have to consider the consequences associated with not conducting research. What's the risk of research versus the risk of inaction? And that was brought up again and again. There was very little support for classifying this research. We heard from Dr. Fauci that that is not an option that NIH is going to consider, so that's off the table. But we also heard from everyone, that from many people, not everyone, but we heard from many people that classifying this research could potentially hamper its public health mission, so the information is not going to be available to those who need it. Certainly could dampen international collaborations, because it's then not going to be available to the international partners who are so important in the surveillance and in research as well. And it engenders suspicion. When things are classified, there becomes an issue about motivations and concerns about how this might be viewed in terms of the treaties we're already signatory to. And there was a lot of discussion about the importance of enhancing the culture of responsibility, codes of conduct, best practices, and engaged investigators. And that's something that the NSAB has worked very hard on. I think Joe Canabrocchi in the last session we had previously made a very strong argument for the code of conduct and how important this is. And I'd just like to say, on a side, that I think this community has generated that kind of culture of responsibility in this moratorium that you've been engaged in. And I think few things could probably more strongly demonstrate to the world that this is a community that really cares about these issues. There was a discussion that intentionally engineering increased pathogenicity in transmissible strains is more concerning than assessing the effects of transmission on pathogenicity. I'll let you digest that, but I think it's actually pretty clear. The community should consider alternative research strategies, including molecular containment approaches that might help minimize the risk of some of these experiments. Really, again, the idea of there are alternative ways we could do this that might minimize some of the risk of the experiments, yet get us to the same place, and there was discussion about whether that's possible. Everyone's waiting for U.S. government guidance essentially on biosafety level. I think, again, we heard great discussions in the previous session about that. And finally, that this should be a malleable thing. This should be something that could be changed, because the risk-benefit analysis could change over time, and we need to be aware of that. And I'm going to turn it over to Amy.
Thank you, Sam. So now we're going to move into some specific comments about different components of the framework, and let's start with points raised by various individuals about the scope. So with regard to scope, there were some differing views about whether or not to exclude characterization studies of naturally occurring strains. The point was raised that the framework should encompass characterization of naturally occurring strains because these studies can involve some of the same gain-of-function risks associated with engineered strains. There were counterpoints, however, offered to that point that the framework should not include characterization of naturally occurring strains because there is an immediate public health imperative to characterize these viruses as rapidly as possible, and also the observation that these studies would still be covered under extant regulations, rules, and guidelines, for example, the select agent programs and the dual-use review criteria. In terms of points raised about the criteria themselves, there was a general observation that all of the criteria require considerable judgment in their application. Also, that they should emphasize the need for a very robust articulation of the public health rationale, the why behind the experiment, a clear explication of the intent, and also all of the associated risks. It was also noted that it would be useful to consider animal health as a component of Criterion 1. And if you remember Criterion 1, it speaks to the not only scientific merit, but the public health significance of the research. And our colleagues from the agriculture world raised the importance of recognizing animal health as yet another criteria for having significance. The point was also brought up that if we are considering projects that involve the agricultural side of the House, that it will be important to confer with USDA and other relevant experts, and also to be cognizant as we finalize this framework about its potential implications for other departments and agencies, and to work closely with them as we move forward. Criterion 2 really engendered a lot of significant discussion. You'll recall this is the criteria about not pursuing research that doesn't have an evidentiary basis in what we anticipate nature might do. And this is where the issues that Sam brought up about what constitutes evidence, what constitutes the foreseeable future came up. And there were a lot of concerns about restricting our research to what we think nature could do in the foreseeable future. And essentially, this criteria was viewed as being too subjective to be useful. And while criterion 2 was not favored as written, there was a tendency during the case studies, and I think Dennis may speak to this in a moment, to refer occasionally to this notion of likelihood to occur in nature as being at least one of the factors weighed in the assessment. But in general, there was not a lot of support for criteria 2 in terms of its utility. There were a number of points raised about the second level of review, points raised about the department level review, particularly about the characteristics that would trigger the need to refer proposals for this additional review. The general sentiment was that the characteristics were too broad. Rather, the criterion for HHS review should be focused on experiments involving respiratory droplet transmission in mammals. And then within that subset of experiments, HHS should consider the combination of other potential experiments, such as reducing effectiveness of drugs, vaccines, or diagnostics, but all as a subset of this general category of experiments that would enhance respiratory transmission in mammals. It was also raised that there's already a process for the defining DURC, dual-use research of concerns issues more generally. And then also with regard to department-level review, the question was asked, what's the added value? Why couldn't such reviews be conducted by the funding agency? There was an expression of concern about timeliness, particularly if we were faced with an emerging threat. What would this do in terms of the timeline for responding? And there was an expression of the desire to see clarification about what the review process itself actually would consist of and the nature, the expertise of the individuals who would be conducting that review. Then in terms of gaps that were identified by a number of individuals during the discussion and on the panel, one point expressed was the framework should address the need for the research to move rapidly in the event that there is a declared public health emergency, and that whatever is put in place should not hamper our ability to mount a rapid and swift public health response. And that there's a need to consider public perception, and not just perception, but understanding of what this research is all about. And I think that previous moderators have brought this up very nicely. For example, to clearly explain the public health rationale for conducting this research, to consider how we might reframe the conversation with the public so that we are effective communicators, including articulating the range of risks that could be associated with the research and clearly describing how the biosafety risks would be mitigated. And at this point, I'll hand the baton to Dennis.
Thank you, Amy. So I made the point at the beginning of the case study presentation that I thought moving from the theoretical to some actual cases with some actual experimental designs would really inform the process and help us get to a place where we understood the givens. And that hope was realized. I think we made good progress there and reinforced the comments from earlier in the day. The case studies, I think in general, highlighted the need for a case-by-case analysis rather than a broad generalizations, and just how much scientific merit factors into the evaluation under the framework. And that came into play on a couple of the cases that we discussed. In particular, I think case D, where people felt it wasn't so much an issue of gain-of-function mutants as this would never pass peer review because the design is hard to follow and the logic is not there and why that experiment is being done. And we heard repeatedly throughout the day and today the need for clear biosafety guidelines for gain-of-function studies that involve mammalian transmissible strains of HPAI H5N1. So again, we're focusing on this mammalian transmissibility. And I think that helps us out of this broad sweep that we were concerned about with the framework in its form as presented to this group. And that I heard from a number of different people, and it makes good sense to me, that transmissibility by respiratory droplets rather than pathogenicity in mammals is fundamental to trigger the department level review. In other words, that's what brought us here. That's what got us into this whole discussion. So it makes sense to focus on the driver of the whole set of concerns. In the actual case studies, panelists determined that cases B and C would generally be acceptable for funding after department level review, although that was not unanimous. I'll spend a little more time on where I think the action is, and that's cases that were determined not to meet the criteria and should not be considered for government funding, and those were cases A and D. Case D I think we can eliminate quickly because that's the one with cloning of the operative genes from HPAI H5N1 into a vector that might even be an irrelevant vector. And the discussion led me to believe that people felt the vector, we didn't know what the vector was to know whether there was a logical set of constructions there. And so scientific merit pretty much eliminated that one. Case A, I think, was a really critical one because that described taking already transmissible strains of HPAI H5N1 that are transmissible by respiratory droplets in mammals and ferrets and determining additional factors that would increase pathogenicity. And so I think there were concerns about could alternative approaches have been taken or whether this would be value added over the original experiments. And I think that a number of individuals expressed concerns about intentionally enhancing simultaneously both pathogenicity and transmissibility, and that sort of, we were getting at a line there in that area of research. I did hear comments from others that, well, it's one thing to drive the equation in that direction. It might be another to look at the natural consequence of evolution of pathogenicity and transmissible strains, because that is more in line with what might actually be expected to occur in nature, coming back to that natural process versus driving something that we don't presently have a clue that is currently occurring. And I know that's controversial. If you have comments that you don't wish to voice here or to think about, then here is the website for sending the information back in writing. We were asked also to talk about topics for further discussion. I don't have a slide on that, but I think that what generated a lot of discussion was what's the differentiation between the first level of review, that is the agency level, the funding agency level review, and the criteria or the process used by the higher level of review, which is stated in the draft policy, is listed currently as HHS. And so that becomes important, and it became simplified in that if we rely on aerosol respiratory droplet transmission as the trigger to get into the second level of review, that simplifies a lot and leaves you with, okay, who are the people that do that and what are the criteria they use to make that ultimate decision? And I heard a number of different people say that it all depends on whom you ask as to how this will be interpreted. It shows the critical importance of having the right expertise at that second level to have the discussion. And I think I'll stop there. Pass it on to Kirsten next.
Thank you very much. Do you want to add a word, Sam? This is a really excellent summation, and it does encapsulate beautifully the full discussion from the two panels. One question which I wonder if you would just comment on, it struck me that these case studies were so revealing that it might well be worthwhile for the department as it continues to examine the criteria to invite and get a number of additional cases, even invite case illustrations from your commentators, and in a way test the framework against the most complex, difficult, or challenging, subtle, otherwise refined cases that may be generated from the commentators. I believe it was so useful for us, I think it would be useful even going forward. So that's a suggestion out of this discussion. And do any of you three have any further comment before we move on?
I think that's a very good point, not only to help guide the funders, but to help those who want to be funded in that you know the rules of engagement if you know what will and will not make it through. You need to know that before you start writing your applications.
Great. In fact, to take that one step further, even when applications are invited, it might be very revealing to the applicants to see how different previous cases would have been interpreted against the criteria. So it's another potential use of cases in this instance.
And that may change over time.
Indeed, it likely will. Amy, do you want to add a word?
Sure. Sure. I think it's an excellent idea to invite people to send in some case studies. Also think that as we move forward and implement whatever form the framework takes, that much akin to the early days of recombinant, where people learn by precedent what had been submitted, what had been approved, not approved. I think we can probably genericize some of the lessons from the different cases that we work through and make that available to the community, not the grants per se, but rather the lessons learned or some of the criteria that were used in the decision making, so that this becomes a learning and iterative process.
Exactly. Very, very helpful. Thank you all very, very much. Well, while the rest of us were enjoying lunch, the moderators from this morning's panel were digesting the discussion. And we're very happy now to be able to turn to the co-moderators of Panel 5 for their summary comments.
So Dr. Reed and I have decided that I will do the honors. Hopefully in the short time we had, we've actually captured the salient points from our discussion. And we were looking sort of to the future, assuming that this type of research is funded, what conditions should be in place. As you can see, the panelists here again, and I'm sorry the background is quite dark. It's hard to see the slides, so hopefully you're able to read that. We had a good discussion with the panelists, and there were 2 questions. But the first question had 2 subpoints. So the first question is whether there are, I can't even read that, whether there are common principles among biosafety and biosecurity requirements around the world. And the subpoints were whether there are any changes needed to our existing practices, biosafety, biosecurity. The second subpoint was whether there were other models of oversight that weren't maybe regulatory in nature. And then the second question was looking at the types of experimental controls that could be put in place to facilitate this type of work. So the common principles that were identified in this session were about biosafety and biosecurity, and biosafety really being a look at the inherent characteristics of a pathogen. Its pathogenicity, virulence, transmissibility, whereas biosecurity being an evaluation of the threats, the vulnerabilities and the consequences, and being in some ways not as much about the pathogen but about the people working with the pathogen and who have access to them. Biosafety and biosecurity are complementary in nature, but it's going to be, as we go forward, important to continue to balance these important safety measures against the importance of transparency for furthering global scientific innovation, and also the impact of restricting research of this nature to high containment labs on facilitating public health research. And that will always be a balance that we need to maintain. In terms of the need for change, there are local, national, and international standards and guidelines that are fairly robust and provide a very strong foundation for conducting research of any kind in a safe way. But there may be work to be done towards establishing a culture of biosafety and biosecurity. Internationally, our biocontainment language is not harmonized, but there are good definitions of some of the standard classifications. And that was made, the point was made that, for example, BSL 3 Ag, and 4 are well defined, but some greater clarity about the types of enhancements and the reasons for those enhancements at some of these interim classifications would go a long way to streamlining our conversation, educating the public, educating the research community. In terms of other models, there is discussion about codes of conduct, outreach and engagement activities, and education as complementary tools for establishing best practices amongst scientists. The other point was that international collaboration can be used as a means to strengthen our biosafety and biosecurity, and there are examples of how that happens. Just engaging these types of conversations inherently improves the quality of our work. And the final piece was that the local level, the institutions and the investigators play an equally important role in establishing a culture of responsibility to the regulators, and possibly maybe even a more important role. Now it's going to get challenging for me to read this. So then the last piece was the role of the experimental design in risk mitigation. So the point has been made many times throughout this meeting that the experiments in questions were well designed, that there aren't concerns about the experimental design of the research that we're here to discuss. But the larger question is, what about the future? How do we ensure that we continue to have this level of confidence as we go forward? So one point has been made a number of times through these talks, but also again today, is that the clarity of the objectives is critical at the outset. Really, we need to have a sense of what the success state's going to look like, because if we're not planning to succeed and we haven't asked all the questions that we need to ask once we succeed before we even start, then there's going to be, we'll have issues. The second point was that, and maybe similar to this, that there should be emphasis placed on predicting the outcome, the impact of the outcome, and looking to put mitigation measures in place at that point. So it's to plan for success and look at the safety features that maybe need to be addressed or the questions that need to be asked at that point. There are mechanisms of biological attenuation that actually have been used in these experiments, and that taking a stepwise approach to gain-of-function research may be one additional measure to at least at the early steps of this type of research, although ultimately it may be necessary to conduct the full-fledged gain-of-function research under the appropriate conditions. And finally, we need to continue making use of what what Mother Nature can tell us, in addition to, and sort of alongside gain-of-function research. And the last thing was sort of a sub-conversation that came out of this session was about biosafety and communications. So the point was made that the public needs to understand that this research is done in the appropriate, under the appropriate conditions, and that these are based on risk, and that the operational and physical practices in place are there to address the unique risks of this type of work. They need to understand that incidents are reported to and responded to responsibly, and that this is an indication of the culture of safety, not of a lack thereof. And the clarity in biosafety language will also help serve to improve this. It was also pointed out that communications with the public is an ongoing process. It's not an event, it's an ongoing process that should promote transparency and understanding and and evolve with the state of understanding and the nature of the target audience. The last piece that we have on here is the role that scientific journals could play in helping to promote biosafety and biosecurity, which I thought was an excellent point and suggestion. They could not only further this dialogue, but help continue to promote the ongoing improvement of our biosafety culture, as they actually have done for issues such as animal care and clinical trials already. And they've played a very important role in establishing those kinds of conversations. And you know, sort of link publication to an attestation that the work was done responsibly. So that's all we have for that. Oh, sorry, we have a few extra, sort of our future messages to address are very broad, because we had 5 minutes left in the preparation, but of course we need to clearly define what biosafety level 3 enhanced or biosafety level 2 enhanced, if for that matter, means in the context of international biosafety and biosecurity, knowing that we aren't fully harmonized in our language, and we need to continue to balance the risks with the benefits of this type of research.
Great. Well, thank you very much. Dr. Reed, is there anything that you want to add from your point of view?
No, I think Kristen did an excellent job.
Wonderful. Thank you very, very much for a really comprehensive overview. Robbert, I don't know if there's any question you want to pose to the panel at this point?
Not at this point.
Okay. And in that event, I think that we're at a good position to turn back to you and open for any additional comments from our audience.
Yes, thank you. And indeed, as I said in the opening words, this is your moment to speak up and address any points that were missed, perhaps, in the discussion or that you want to highlight, want to add. Mrs. Donkers.
Okay, thank you. I'm a little bit confused by the summaries of panel 1 and 2, because the impression that I kept from hearing the discussion was very much a lack of clarity and a lack of consensus on the benefits as well as the risks. And you seemed so very certain from what you heard in these panels that we are in agreement about that. And that's important. It might be just my problem because I'm not a part of your scientific influenza research community. But it's also important if you take it as an aim to educate the public on, for instance, the benefits of this research or the risks. So I would propose to this scientific community of influenza research as present in this audience and behind the table, that you really make an effort to much clearer identify the possible benefits and the benefits that have been reached already, and do the same for the risks. Because I've been here for 2 days, and I'm not clear at all. So consider me a representative of the general public, and humor me, and try to be much more precise and clear about that.
Thank you. I'll turn to our moderators. Do you want to add to that? And perhaps you, Dr. Webster? The need, let's start with, your panel was about the benefits. So do you see a need to articulate these more precisely? What should be done there?
I thought we had, the question was the gain of function and the benefits of gain of function and the 4 questions. I thought we had answered those 4 questions, raising the benefits and the risks. Of course, we can always do better and consider further the risks. I guess the difficulty I had was that there was more benefits, more speaking on the part of benefits than risks. And so, Kanta, would you like to pick it up from there?
No, I mean, I think when we were given the notes that, you know, in addition to the notes we transcribed while people were talking, we were given notes that were recorded and have tried to synthesize over and above my own impressions and Dr. Webster's impressions, and went through and tried to capture the consensus.
Feel free also here to add your own opinion or something. You know, it's just, you're not just as moderator here.
Right. And so we've tried to do that both in the summary as well as in the points that we wanted to raise for further discussion.
Good. But maybe we should give Dr. Donker.
Yeah. Well, I want to clarify. This is not a criticism of the work that you did. It's just, take me as an example, having been here for 2 days, and to me the benefits are not yet very clear, because I seemed to hear a lot of discussion about the use for surveillance, for instance, or the use for vaccine production, for instance. And I came out of this discussion with the feeling that there is, even within your community, not real consensus about these benefits. And the same goes for the risks. So it's not a criticism of your work, to summarize, but it's just an observation that might take us forward if we take it seriously.
Anyone on the panel that Amy, you want to say something on that?
I want to thank you for making that comment, and in some ways I share the perception, although I agree with the assessment that you made of the panel. I think the distinction here is I think the relationship between some of the research findings and ultimately having a diagnostic, a prophylactic agent, a therapeutic agent is a complex one, as it is for any drug or therapeutic intervention. And I think what we heard was some of the complexity of that translation. But I do think that the bottom line message was that the research does support these aims in short term and in longer term. But I think you're quite right, Mariana, the community needs to do a better job in clearly articulating, making those dotted line connections, and to also show the other side of the coin, that in doing this research, there are inherent risks, and we've talked a lot about them in the past 2 days, and we need to be very plain-spoken about what they are and what are the practical measures that are in place and required to address them. And I think that is one of the major take-home points from this meeting, is this whole notion of being better at articulating, explicating, putting out on the table, and communicating in a very transparent way. I did want to say that I do think that I want to acknowledge that there are many people in this room who do not belong to the influenza research community, lest you feel you all cast into that bucket. I think we have a wide range of people here. I just wanted to make that clear.
Nancy, you want to add that to that?
Regarding the risk benefit. Yeah. Okay. Yeah. Regarding the risk benefit, I think the concept of risk is very vague. It totally depends on the people who think. So the risk, even I cannot say what kind of risk exists in gain of function research, because it's a kind of possibility. We did not experience the true risk, true event based on the gain of function research. So this is a kind of possibility. And I would say gain of function does not immediately connect to some kind of misuse, just a possibility. So important point is how to mitigate the risk. And we cannot say what kind of risk would be happen in the future. And also an important point is we need to study in each experiment case very carefully. And I would like to study, scrutinize, and raise a problem in each case. And we need to think the solution one by one. So that's an important point, I think.
Dr. Cox, you want to add to it?
Yes. Yes, I really appreciate that comment. I felt the same thing at the end of the day yesterday, and actually spoke to my colleagues about this very point. And I think it's incumbent upon the influenza community to very clearly and crisply delineate the benefits and the risks. Do that first for a scientific audience, because that's who we're used to talking with, and then boil down what we've put down in a more complex scientific forum to the essentials, and try to put that into plain language so that members of the press who may not have delved into influenza issues over the years can understand it, and also the lay public can understand the information that we're trying to provide. And I think the topics that we need to cover are dual-use research of concern, H5N1, the threat of H5N1, the biosecurity and biosafety components that are applied to this type of work. I think it is difficult to explain that to people who haven't worked in a laboratory, but I think it's incumbent upon us to do it. I think that I've heard criticisms that the influenza community is rather insular, and maybe even a bit arrogant in some of our responses. I think we all need, those of us in the food community, need to take these comments to heart and really do a better job.
I want to turn to the next question. Yes, please.
Yes, thank you. Ron Corley, Boston University. I'm not a flu researcher, so I'm going to comment strictly as a researcher. And this conversation that we've had the last couple of days, I think, is a conversation that we could be having in the future about a number of different issues. I think all of us who do infectious disease research are very comfortable talking about things from the perspective of biosafety, biosecurity, enhanced research occupational health, personnel reliability and security, and communication with the public. And I think those of you who know the history in Boston the last few years know that we've had significant difficulties in communicating with the public, and it's something that I think we've learned a lot about. But those issues, I think, are positives that come out of this meeting. Where I have a concern is this department level review, because this department level review to me takes us to a place of no. It tells me that we don't trust our peer review system, and quite frankly, when I listened to the case studies yesterday, what I heard was peer review. I didn't hear second level review, I heard peer review. And it takes us to a place where we don't trust our IBCs, we don't trust our DIRT committees that each institution has to have as responsible parties to talk about how they mitigate these issues and whether or not the research should be done. But it takes us to another level of review, and the only reason that I can think of that other level of review is that it's a level of no. And getting us to a place of no from a funding agency that's supposed to be supporting science that meets the elements of peer review troubles me, and it troubles me greatly. So I wanted to put that comment there just to get it.
I think this is quite a crucial point. Appeared also yesterday in the discussion, what exactly happens when the review process moves one level up at the departmental level. Maybe you want to say something about that?
I'll say something. Maybe some of the other panel members or members of the audience would want to. I think it's a valid concern. I do want to emphasize, however, that the intention of a department level review is not just a place where the answer would be no, but rather first to identify, have a framework or have a system that enables us to identify that subset of gain-of-function HPAI H5N1 research that requires a broader look, a second check. It's an expression of the funding agency's willingness to say this is important. So first remember, anything that goes to the department is something that the funding agency has already evaluated. So we would already have our sense of it. But it's a subset of that research that possesses a characteristic, namely that, at least according to the discussion that's gone on here today, that we're talking about a virus that has transmissibility via respiratory droplets in mammals. And so it's already in a category that we want to make absolutely certain that we've taken into account the full range of security issues, the pandemic preparedness issues, the availability of countermeasures, any limitations, and to be doubly sure that we've left no stone unturned in making that funding decision. Now, how the framework will ultimately end up will need to be decided, and it will be greatly informed by this discussion and the comments that you send in. But that's the spirit behind this proposal, that there be this additional level of review for a subset of gain-of-function experiments. It is not intended or engineered to just be a place of no. It's really to make sure that we have left no stone unturned in terms of being good stewards and not just wanting public trust, but engendering it and meriting it. Dennis, do you want to add anything?
Just thinking, we might be confusing people when we talk about first level and second level of review, because the norm is the first level of review is the peer review study section, and the second level review is the advisory council by an outside body advising the institute. And in some ways, what this feels like to me is an advisory council advice to the funding agency based on all those other elements. So that's my personal view. So maybe we're talking about a third level review and a fourth level review if we've gone beyond those two things to feel like we need the funding agency review and then the department agency review, which is really a four-layered process.
Any further comments on this issue?
It's comment from Dr. Fauci.
Tony, you want to comment?
I want to comment on what Marion said and go back, not the issue there. But now that you have me, I could give you my comment on that. There's also the issue that was brought up in one of the NSABB, that when you have a situation where you want to get an extra review, you want to take it at least symbolically out of the hands of the people who have a vested, sometimes perceived as conflict of interest, judgment on it. So if we say that this should be done, then all of a sudden the people say, well, of course, you're funding it, you want it to be done. So if you go to another level, which includes not only your department, but people who are not in the funding stream, security people, safety people, people with other issues. And I think that's another reason to bring it up to that second level, in addition to what Amy and Dennis just said. So,
thank you.
Could I get back to
You can.
I think Marion brought up a very important point that has been discussed at various levels, and I just want to take less than a minute to maybe add a little bit specificity to it and perhaps satisfy, Marion, your concern. And I think it was a comment that was made by Malik Paris in the panel that he was on, and that is when you talk about the benefits of the research, we have to be careful to make sure we don't talk only about the absolutely immediate benefit of a research. Because the point is that if you, for example, take surveillance as one component of a benefit, there's been a lot of criticism that if you know the mutations that were identified by Ron and Yoshi, that it wouldn't immediately help you with surveillance. That may be true, but it could really greatly help you in the whole functionality of what happens when something adapts from one host to another. So I know that was not articulated that way, but I think maybe for people who are, quote, general public, they'd understand. It's almost kind of like doing research that you don't have the fundamental benefit of it the next day, but accumulatively over a period of years, you may have a greater insight into the whole concept of host adaptability. I think that's what Malik was referring to. I don't know if he's still here, and if, yes? Yeah, okay. Thanks.
Okay, thank you. Next question, please.
Hale, Foundation for Vaccine Research. First of all, I would like to echo and thank Mariana, because I'm afraid that I agree with her. I also heard no overwhelming consensus that the benefits of this gain-of-function research outweighed the risks. On the contrary, I heard many reservations expressed by any number of panelists, and one panelist was opposed to this research proceeding. He's no longer here. I wanted to step back. I just wanted to make that point, and Mariana, you were not alone in feeling that way. The reason that our foundation, that we became involved in this debate, is that we see the whole H5N1 research controversy as part of a much larger problem. And that problem is public trust. As a vaccine research foundation, part of our mandate is building public trust. In building public trust in vaccines, in vaccine research, and in biomedical research in general. The impact of the H5N1 research controversy undermines all of our efforts in that field. This is at a time when we have an anti-vaccine movement, when we have what sometimes appears to be half of Hollywood is opposed to vaccines and immunization. In France, the anti-vaccine movement has merged with the anti-GM foods movement, which adds another level of concern. In Europe, many people are opposed to anything that is genetically modified. I don't need to remind people here in this audience. So I have a question. I believe that there is a genuine desire on the behalf of the organizers of this meeting and other meetings for greater public involvement in this discussion. I'm not sure that that desire is shared by everyone, in particular in the influenza research community. But let's say that there is a genuine desire for greater, genuine public involvement in this debate. Here's my question. How do we involve the public? I don't know the answer to that question. It's part of our mandate, and I simply don't know the answer. Who would we invite to a meeting of this kind to represent the public? We don't have an obvious community out there to invite. It's not like HIV, where we have an HIV community, or even cancer, where we have patient advocates and a whole community of cancer survivors to consult with.
Thank you.
I am stuck and would welcome your help, because I think other meetings that follow this, we need to find them. There's no one here representing the public. I have looked. There's no one. We need to find a way to involve them.
Thank you. An excellent question. I mean, anyone here wants to try to give an answer to it? Or do we step out of the community? Amy.
Go ahead, Rob.
The point that we must engage the public is absolutely correct. We must. And I would like to hear from anyone in the audience who is here from the public, their opinions. That was my point at the very first of the first panel, to invite response of this meeting from the public. So please, let's hear it. Your points are very important for us to hear. I find it hard to believe that there is no one in the room representing the public. So if there is, let's hear it. That's part of the center of this room was held for the public, and that's what we're here for. That's why I came.
I guess we also all representing the public in some sense. Amy, you want to add something to it?
Well, also, I think it depends on how one defines the public. I think we all are members of the public. Certainly we have members of the press here and others. Just a thought in terms of one potential existing network of people who in many ways bridge the public, the communities adjacent to facilities where biologic research is performed, and biosafety. One thought is to reach out and invite the public liaison community members that are a requisite component of the IBC system here in the United States. We require that all biosafety committees have a public liaison. So one potential strategy in moving forward for future meetings on topics such as this or related topics is to make sure that we reach out. We certainly did for this meeting, reach out to all the IBCs, notified them. We have a listserv. But that might be one way of getting people who are already trying to bridge the concerns of communities and the general public and play a part in the IBC oversight process. And I don't know whether people like Joe Canabrocki and others who are deeply embedded in that community might have a perspective, or Kirsten, whether that would be something even worthwhile to consider.
Dr. Shinimai?
Regarding the outreach to the public, this is not the case in the influenza community, but I know some information from the synthetic biology community. They often have scientific cafe to discuss various issues among the people. And also sometimes they play card game with kids to educate what the synthetic biology is. And also they have some connection with the society and discuss what kind of research can be done in the synthetic biology, and what is the aim and what is the benefit and what is the concern. So during those activities, the community can imagine what kind of research is done in synthetic biology. So such kind of activity is very important to share the information. Thank you.
Thank you. Then I would like to finally turn to you. Yes.
Hello, I'm Barbara Jasny from Science Magazine, and I wanted to reinforce some of the points that have been made before about being careful of how you describe the benefits, of not hyping that too much, and of not, in an effort to try and present the benefits in a rosy light, undo the good work that you're doing. I was very struck in the preliminaries up to the publishing of the Fouché manuscript that when the risks and benefits were presented to representatives of the Netherlands government, one reaction that was received was, oh, well, if there are these benefits are so strong, then this is applied research. This is not fundamental research anymore. I think I agree with Dr. Fauci that explaining the benefits in the general terms of this research, rather than trying to be very specific, may do you more good in the long run. Presenting it more in terms of we are fighting a war with influenza, and just as in war you gather intelligence, and not all of that intelligence will be directly useful, but this is what you need to do if you're going to win a war, may be very helpful. I would also remind you that communication must be a two-way street, that one of the problems that the GM community has had, certainly the companies who are portraying it, stem cell research has had this problem, gene therapy, that they believe that if you told people these are the benefits, then people will automatically believe it and everything will be fine. Whereas many of the surveys have shown that explaining the benefits doesn't always take away people's concerns, and you have to have this kind of two-way communication if you're going to proceed. And if you want to talk to the general public, and if that is the prime motivation, then you need to go out there. You need to go to town hall meetings. You need to go to school meetings in the evenings rather than expecting people to come to NIH for a two-day meeting in the course of a business day just before a holiday. So I think the kind of outreach you want to do may have to be targeted very differently. But I can't say it enough, it's got to be two-way.
Thank you. Next question, please, or comments.
I'm Jimmy Kolker from the newly named Office of the Assistant Secretary for Global Affairs at the Department of Health and Human Services. I wanted to comment on the departmental review, but from a little bit different perspective of something that I didn't see in the summary, but was a fascinating dialogue this morning with Dr. Dixon and Anna Lönnroth-Sjögren from the European Commission, and also Kevin Wolf's presentation. And the options available to, if an unanticipated result of very legitimate and desirable research were to mean that the U.S. government were to say at some point, we really don't think this should be published in full, even though that was the entire assumption and of the funding and the way in which this research was started. The instruments that we have at our disposal to make that happen are exceptionally unnuanced. Export controls means that every single person who might have access to that data, and if this is shared with surveillance authorities through WHO or some other way around the world, numbers in the thousands, if not tens of thousands, needs to be reviewed by name for release of the information. It's clearly an impossibility if we want to move this fast. The sense that if the information is restricted, one interpretation at least is that under the Freedom of Information Act, it couldn't be shared even among people within the U.S. government without making it subject to public disclosure through Freedom of Information Act. So the funding decision itself takes on an additional importance in terms of accountability and answerability to the public, that the funding decision needs to be one that's not just based on, is this research that NIH wants to support and is, seems like a good proposal with necessary safeguards, but is this one which, if there's an unanticipated result, one where the U.S. government can take a kind of political as well as scientific accountability for having encouraged that research to go ahead. And it seems to me that somewhere in some of the summaries, the current lack of real policy nuance of being able to move after the funding is approved to have any influence on how that material is or isn't published, is or isn't used, is one of the real constraints we have in dealing with this topic. So thanks very much.
Thank you for adding that important point. I would like to go, is there anybody who wants to add to that? No, then I would like to go to you, Ron, for next question.
I would like to comment on a few issues. First, I don't think that the purpose of this meeting was for anybody to walk out of here with a consensus opinion. This meeting was set up to just hear all the different opinions.
Explicitly not, yes.
It is not surprising that, Dr. Donker did not hear consensus on anything, because I think that Dr. Patterson went through great length to get a broad opinion as possible around the table, running from maybe myself on one end of the extreme and Dr. Inglesby on the other end. And I don't think it was the purpose of this meeting to get us to form a consensus amongst the two of us, for instance. Having said that, there is consensus on the fact that there are risks to this research. I think we heard consensus that risk can be mitigated at level 3+. There are minor opinions that it should be level 4, but the majority vote, I think, there was 3+. And as for the benefits of this research, this has already been discussed in February at WHO. The benefits, there was unanimous decision of the benefits of this work from the influenza community. Now, whether the people would agree on those benefits, it's questionable whether those people understand with the information that they've been given. But due to this controversy, I have traveled to many public meetings. I have spoken almost every week to the public since this controversy started. And I've not been to a single meeting where the people have left the room being uneasy about this. They were all convinced that this work was done safely. They all saw that there were benefits, and they all agreed that this work should be done. So I've not spoken to a single individual yet in the Netherlands and in Germany that would oppose to this work, after being told the facts.
Thank you. Go to the next comment or question.
Joe Canabrocki, University of Chicago. Amy, I just wanted to respond to your invitation to comment on your suggestion of pulling in IBC public members for a discussion. I think it's a good suggestion and a step in the right direction. I think, however, that's an audience that's already better informed than general public. I mean, these folks attend monthly IBC meetings and thereby are, 3 hours a month, sit and listen to the debate of risk assessment in science. And just by osmosis are better informed, I think, than the general public. So I think it's a good start, but I think it's not a complete. Now there is no way to do that. There are many levels at which we have to engage the public. Just the general promotion of science overall. But then specifically, that's on one extreme, and then very specifically on issues such as what we're dealing with here for this workshop. So there is not a magic bullet in my mind in how to do that. It has to be a multifaceted approach, but something that we work on full time. This is not a part-time job, and it doesn't happen just once, as was so eloquently stated earlier today. It has to happen all the time on an ongoing way. So. But again, to bring in the public into this discussion in particular is an important task, and I'm not sure of the best way to do that. Certainly, IBC public members might be a start.
Thank you. Next remark.
Yeah, so I'd just like to have a clarification and a reassurance, because I saw on one of the slides that characterization of naturally occurring viruses also gets caught up in this whole issue, which to my mind should not be there at all. These are viruses that are present in nature, and it's a public health priority to immediately characterize them, including transmissibility. And if I can be reassured, I have a follow-up question.
Amy, can you clarify this?
Yeah. Thank you for that comment, and your observations are apt. We included both sides of the issue because both sides, both opinions were expressed as part of the general discussion, and so we were trying to be true to the fact that both sides of the coin had been emphasized.
But it was just summarizing the debate, right?
Yes.
Yes.
Right, okay. Yeah. But let me reiterate, naturally occurring viruses are not gain-of-function viruses except insofar as they are gain-of-function in nature. So I just then want to follow on from there. So you have, if you like, two extremes. You have naturally occurring viruses, which I think should be characterized, including transmission, as an order of priority. And then you have experiments, as was described, which are designed to understand transmissibility and transmission, which is total gain-of-function research. And then, much closer to the first, you do have viruses which are naturally occurring individually, which may have one mutation and another virus has another mutation of concern. And we would want to know, for public health reasons, whether these two mutations combined would be transmissible. So I would like to know whether this would be characterized as gain-of-function and would have to go through this whole process. Because to my mind, that is also urgent public health response. Because using this information that we got from the studies of Ron Yoshi and also a lot of previous data, we do have a number of mutations of biological importance. And if you see them in viruses, particularly closely related clades of viruses, individually, you assume that they can come together, and you want to characterize those viruses urgently. So I'd just like clarification as to how you see those experiments.
Another case study, actually. Some of the panel members want to give a try? Dennis, would you?
I think we got close to that with the case on looking at the human influenza virus in swine along with the swine viruses in swine. And I think that we thought that that was something that should go forward, but I do believe it was swept into the scope of the proposal as written. So that's a point for consideration that Malik has made.
Yes.
So it presently would be included as something that would need to go through that assessment the way we laid it out. So Nancy, I think.
Right. So, but if you're taking a virus, I guess it's the intent of the study, isn't it? So you're intending to determine if those mutations make the virus more transmissible, but you don't know that they will.
So the question is
and so does it go,
or not?
but does it go, and are we going to still have number 2, and what will the wording be in number 2? So it's not clear whether in the revised, the next iteration of the framework, it would move up or not, at least not in my mind.
Amy.
This is perhaps something that would be good for people to comment on, because it's clearly very practical. It speaks to the ways that we might revise the framework or not. So I would encourage people to write to us comments on this issue.
And possibly also other case studies that come to mind, right? Yes. Yes.
Yeah.
Next remark, please.
Mark Frankel, AAAS. A somewhat different take on the education issue. I think we'd all agree that the science is complicated, but I think we'd probably agree that how the framework is to be implemented may also be complicated. I mean, it's not that straightforward. A lot of questions have been asked during the course of the 2 days, and the answers are not crystal clear. Hopefully they will be. But my comment and my question all wrapped up in one is, are there any plans for some sort of educational component to the rollout of this framework that would be aimed at the scientific community, the researchers and the institutions, to make very clear what the expectations are of the community and what their responsibilities are? I haven't heard anything about what HHS or NIH plan to do along those lines to make sure, as we have with things like conflict of interest, human subjects research, et cetera, developed educational possibilities and programs and materials aimed at those who are responsible for implementing them. I just haven't heard anything, and maybe there is something, but I'd be happy to hear whether you have something in mind with regard to that.
Mark, you raise an excellent point, and that should be an integral part to any new policy or new requirement, and we'll be moving in that direction. But I think the first order of business is to get your input, get input from the larger community about what this framework should look like. And then once we have a firm grasp of what this framework looks like, what it would be requiring, that will determine the substance of the education and who's on first, who's on second, who has what responsibilities. So your point is absolutely spot on, but I think we're at an earlier stage right now to try to craft a framework that is responsive to the concerns that we've heard and is reasonable.
Thank you. Yes, Dr. Shino.
In collaboration with the University of Bradford and London Network Centre for in Italy, we surveyed about Jewish education in Europe, Japan, and other countries. And the results were almost similar in all over the world. There's a lack of educational materials and lack of funds for doing education, and lack of instructor, trainer, and a lack of time for education, especially in the university. So we need to improve these points. And at least we are currently developing, and also we develop some educational materials for scientists. So you can go to the Virtual Biosecurity Center, and you can pick up several different sort of educational materials. So those kind of materials can be applied for the education for life scientists.
Great, thank you.
I think it's a good last comment. Tomoko Steen from Library of Congress. We received a lot of questions from not only the U.S. but worldwide about this issue from public. And our place, we host lectures by scientists, something like global warming or something like this. I like to, I was listening 2 days and tried to search who is a good speaker to come to Library of Congress and talk to the public as well as the policymakers. Some of the members of Congress are coming to our lectures. So I'm happy to give a praise to, they have a public dialect. So that's what I wanted to comment.
Thank you so much, and what a wonderful kind of high note to end this this public discussion. I think looking around to, just one more question, please come.
My name's Andrew Clements. I'm with USAID. I was a postdoc here at NIH in the mid-90s, and there was a mini med school that was organized in an effort to, I think, do community outreach and also to inform people or demystify science and medicine for people around. When they opened up, they had, I think, 200-300 slots for people. When they opened it up, within 30 minutes, I think they had 1,500 names. Wow. So they rolled those names out over 3 or 4 years. I think the youngest person there was probably a teenager in high school. I think the oldest person was 80, 85. So it was quite a broad section of the community. I don't know if that sort of thing still exists here at NIH, but that might be a good opportunity to reach out to the community, get different opinions. Obviously, it's probably mostly from around this area, but it might be a useful model.
Thank you. Well, perhaps this is indeed a good point to kind of close this discussion, because I think we are definitely reached a point where all agree that this open nature and an open engagement is very important. And of course, I think this meeting was in many ways representative of that attitude. And I must say, I personally felt very honored to be here on behalf of the InterAcademy Council, which is an association of more than 100 academies of sciences and engineering and medicine across the world. And if I can add a few personal remarks, and then I will turn to Dr. Feinberg to say something much more scientifically solid, that as a simple physicist, I also want to make all of you a compliment, because viewing it a little bit from an anthropological point of view, I think this community is extremely frank, it's well informed, you share smart and articulated ideas, you're well organized, and you are all very much aware of the need to engage with the public. And I think these are all excellent qualities that I really want to compliment you about. I think it was Dr. Casadeval who mentioned the analogy with cosmology. You know, cosmologists these days are very happy that they are at the point where they can claim to understand 4% of the universe, 96% being dark matter and dark energy. And I have the feeling that in some sense people studying viruses are not yet at that level and should be very happy with 4%. And in fact, we have had a large discussion here about these kind of unknown unknowns. And I have to think actually of these old map makers who were mapping out the world and of course had a lot of empty space that still had to be mapped out and then often filled it in with wonderful sea monsters and creatures. And in some sense we are, I think, in the process of chasing these sea monsters out of the maps. And I think this discussion here these 2 days was extremely important in that respect. If I can pick out just perhaps one thing that really struck me is that discussing all the benefits and risk, a very important role was played by the international community. And I think we should be aware that the growing international networks give, of course, tremendous strength and benefits to all our research efforts, but they also give risks in the sense we are all in it together. And across the world, of course, we have great diversity in capacity and exposure to these risks. And therefore, I found it very rewarding to understand that in some sense the most flexible and well-organized way to address these risks is the scientific community itself. We had lots of examples of this and encouraging messages that the strength of self-organizing, self-policing, the role of education, of transparency, of flexibility, all, I think, aspects that we consider to be the core value of the scientific enterprise are absolutely crucial in building, in some sense, these defensive mechanisms. And that public outreach is crucial to that, but of course not only crucial to this subject, and I think actually there's enormous room here to learn from various disciplines and different cases about best practices. So in that sense, I think this meeting and this whole issue resonates very well with an effort that the international community of academies of science is undertaking, is working on scientific responsibility about research integrity. We issued a report just a few months ago, but we are kind of entering a second phase, very much directed by educating, particularly the younger incoming generations of scientists, and having some kind of a manual, or at least some way to engage them, and I guess also the public in large. And the only thing I can offer here as, in some sense, help in this effort is that certainly I think science academies, academies of medicine, of engineering, are across the world in a very good position to inform the government and the academic community and the public at large, and perhaps help in some way to achieve what I think was another message that we heard many, many times these 2 days, which is the kind of the harmonization of the various national efforts here. And so this is truly an international problem. It's very important, I think, that we had such a broad delegation here. And I want to compliment the organizers of actually taking this step to bring this group together. I felt myself very honored to be part of you. And then now I turn to my much more knowledgeable colleague.
Well, Dr. Dijkgraaf, thank you so much. I have to say at the outset what a pleasure it has been to have the privilege to co-chair the meeting with you. We started yesterday morning with 2 goals in mind. We wanted to engage in an active dialogue and enlarge our mutual understanding of these complex issues around H5N1 research, and we wanted to have some specific opportunity to examine, reflect on, comment, and try to improve the initial draft of the framework. I think it's fair to say that we've accomplished both goals in the course of these last 2 days. From my vantage point, it's the very same property of highly pathogenic avian influenza that makes the potential public health value of research so great that simultaneously introduces high levels of concern about risk. And so it's inescapable, the two properties are the same. Both what makes it more important and more challenging, more demanding and more necessary to investigate, and what opens the possibility of risk by safety or through security risk at the same time. If we're honest with ourselves, we also have to recognize that there's substantial uncertainty on both sides of these equations. Uncertainties when we embark on the research, uncertainties about the value that the research will hold ultimately in protecting the public, and uncertainties about the degree to which the risk will ever manifest. One thing I would say is it's a very natural human inclination to have a kind of cognitive consonance in your beliefs, so that if you start focused on the risk, you will tend to diminish the value of the research. And if you start persuaded that the research is necessary, you will tend to diminish the significance of the risks. And one of the reasons I was so pleased that we tried in this discussion to separate the discussions about benefits and the discussions about risks is it gives us the best chance of trying to lay them out thoroughly, honestly, candidly, with all the uncertainty, and still keep both in mind without necessarily trying to superficially subsume the one under the other. In flu research, especially when we're concerned with pandemics, there's always a danger of overconfidence and overinterpretation of meager data. One of the fundamental realities is that the periodicity of influenza pandemics is very long relative to the human lifespan. And unfortunately, what that means for all of us is that we have a long time to think about very few points of data. And so it's easy to overinterpret and to see a trend where perhaps none really exists. To imagine that we are, for example, seeing a decline in the severity of influenza over the last century, when if you look over 3 centuries, you don't see such a pattern. And even if you did, would that be a measure of confidence? And so we have to enter all of these discussions with a very high measure of modesty, willingness to listen, openness to others' ideas, attempts to be as faithful to the actual evidence as we can be. And that's why I found all of this discussion, particularly in this last open session, about the importance of developing and laying out very clearly and cogently the argument around benefit, and to face honestly the risks, and to communicate in both directions with the public, to hear from as well as to reach out to, also very important in enabling us to make genuine progress. The one insight that I have gained, I would say, from this discussion that I hadn't fully appreciated before beginning was the very high importance of decision-making at the time of initiating the research. And I would say it means a high burden on the scientist as well as on the funding agency. And the reason for that in part is that when you go past the time that the research has begun and then completed, as has been pointed out, there are very few opportunities beyond that time to do anything of consequence that's acceptable in containing or controlling or managing what emerges. We have no good mechanisms to stop the information from being disseminated. We have no ways to do in a reasonable way classified research on this subject, both for practical and for ethical reasons. We've heard that the restrictions on export controls are a very blunt instrument, not very well suited. Some people have talked about classifications that's not really classified, sensitive but unclassified information. That is a swamp, best to be avoided. And therefore, all of this leads back to the question, think very carefully when you're going to embark on this research and when you are going to underwrite its cost and fund it. And that, I think, has been a very important motivation behind the conference, and also a very important gathering of insight, advice, and ongoing engagement with both the scientific and public communities to enable these decisions to be made in the most fully informed and effective way. So while obviously this is one step in a long path, I think that it has been a very worthwhile exercise and one that we have all benefited from who have been here. I want to just take a moment on behalf of both Robbert and myself to acknowledge the extraordinary effort of the staff who helped lay the groundwork and prepare the way for this meeting. We had the privilege of meeting with a number over the course of preparations, and all those who worked with Amy Patterson under her direction and to help her to carry out this magnificent planning effort, we owe our great thanks. And Amy, to you and your colleagues, we do want to express our great appreciation. And in closing, I just want now to turn, if I may, to the director of the NIH, Dr. Francis Collins, who will offer his concluding remarks to the assembled.
Well, thank you, Harvey, and thank you and Robbert for your skillful moderation of this final discussion and your moderation of the entire meeting. I think that has been a great contribution. And again, thanks to all the panelists, to the moderators, to the audience for a very engaged and helpful conversation. I will speak briefly because it might be said at this point that everything that needed to be said has been said, but not everybody has quite said it. I will try not to get in the way of our drawing this to a conclusion. But I did want to say, from my perspective, having invested countless hours on this issue of how best to oversee this kind of dual-use research over the course of the last 13 months, that this has been a very useful opportunity to try out this framework that we put in front of you with a fully open mind about which parts of it might seem to be effective and which parts may still need some thinking. And I think we got that input. Again, I hope you do get the sense of just how seriously the NIH and our partners in HHS have been attempting to put in place a framework that would be responsible in measuring benefits and risks of this kind of research. I can't tell you how seriously that engagement has been going on over the course of many months with countless conference calls and interactions, including with Sally Howard, who was here yesterday as the Chief of Staff to Secretary Sebelius, Bill Corr, who's the Deputy Secretary, many others, some of whom are here in the room, engaged on this issue over many iterations of trying to identify the right path forward. But we really needed this opportunity to see what this group of experts, and with wildly different perspectives in some instances, would think about the way in which we were proceeding. And I think we very much got that. And this is hard, let's admit that. If this was a circumstance where there was an easy path forward, where you could simply write down in an afternoon how best to handle this, well, we would have done that. And so if it still seems a little blurry in terms of exactly what the benefits are and what the risks are and what the right path forward is, I think that is actually an indication of just how hard this problem is. And interestingly, it's hard, even though we narrowed it down. You'll notice, and I'm sure you have all along, that the topic of this meeting intentionally tried to focus on a very small subset of dual-use research, namely gain-of-function research on highly pathogenic avian influenza H5N1. And if we had tried to have a conversation that extended beyond that to a wide variety of other kinds of experiments that could teach us important things about biology but might also have the potential for misuse, then we would have really had a tough time, and I suspect we would not have been able to get nearly as far as we did with this. It's important, though, that by identifying this narrow and very topical area, we hope to establish at least something in the way of a general set of principles. And if we can get this one right, then the hope is we can go on to some of those other issues undergirded by something more in the way of a foundation than we've previously had. That certainly has been the hope of all of us. Again, the comments for this input, for this framework, should not be considered as coming to an end right now. The framework will be up there seeking public comment. That will be available for comment until January the 10th. And again, I think you've seen this particular URL several times, or email address rather, several times. There it is again. Really want to get that input through the course of the next couple of weeks. Another goal we had here also was to try to provide some input to the global discussion, which we thoroughly recognize needs to have its own opportunities to go forward. but hopefully this will be a useful contribution to that. In order to facilitate that, the webcast, which has been collected along the line and will be posted soon, should be available to guide people who want to hear more about what happened here. And there will be a meeting summary, which will be put together with great alacrity, I'm sure, because of the need to have this available to others, although, as you can imagine, it won't be trivial to try to capture all the components here. I must say the slides that were shown as part of this final discussion summarizing what the panels came up with as far as capturing comments, those alone could be very useful. Amy, will those be posted relatively soon? Because I think even before the webcast is up there for people to sift through many hours, and even before we have a text written summary, to have those summaries from the panel chairs would be, I think, very useful to put up as soon as possible. So I think without further ado, I want to thank you all one more time for a really remarkable milestone that you've been part of in a very important question. We are here at the nexus, I think, as Harvey was saying, of an area which both has great potential, recognizing that the disorder we're talking about, influenza, has created enormous human suffering and death over the course of history, and that therefore we have to take it with the greatest seriousness, even if we are not at the moment in the midst of one of those pandemics we know we shall be at some point. And yet also we're at a point, because the technology is moving so quickly, where there are justifiable questions and concerns about the exact risks posed by gain-of-function research. This is a place where the goals of science and society have to be looked at with great intensity, and we have done that. And I think probably people will write dissertations about this whole enterprise, and I hope they will judge us kindly, recognizing that, as Robbert said, we'd be lucky if we claimed we knew 4% of what we need to know about this field. But we're doing the best we can with what we have, and I thank you all for that. There will be a press availability, as we had planned, for members of the press who want to have a chance to ask some additional questions. It will convene in conference room A at 2:45, so that's 20 minutes from now for press that are interested. But for the rest of you, I have all this just one more time to say thank you and to wish you safe travels and a wonderfully happy holiday season. Thank you all very much.